But we begin with Beaumont officials sounding the alarm, saying that their hospitals and staff are overwhelmed with COVID patients. That story tops our news here at noon. Thank you for joining us. I'm Evrod Cassimy. Beaumont has hit critical capacity with coronavirus cases soaring here in Michigan, and they say they're caring for more patients now than in the fall, and more than 6 times the amount from February. Local 4's Rod Maloney joins us now live with more on these pretty troubling developments this afternoon. And Rod, they're begging people to take all the necessary steps to stop the spread.
That is true, Evrod. And here's the thing, they're asking for a community call to action. That's the exact quote from Dr. Nick Gilpin today, where he's asking for everybody to really redouble their efforts to try and prevent the spread of COVID. Now, they did say that the Beaumont hospitals, all 8 of them, have 800 COVID patients right now. And it sounds like a lot because it is. Now, it is not the most that they've ever had. Back a year ago, they had something on the order of 12 to 1,300. But the doctor says that's something dramatically different in that back then the hospitals were largely empty and were just COVID hospitals. Now they're trying to have other patients in, and they're trying to discourage the notion of not going to the hospital during this pandemic. And so the problem for them is staffing. They say their staff is tired. Doctors, nurses, everybody servicing the hospital, they're all tired, and it's been very difficult. And when you have 800 patients like this, and that they're younger patients, they're saying that the average age is something on the order of 50 years old now, that it is a real problem. And so they're asking everybody to do what they can to prevent the spread, but they're also asking the governor to reconsider her position of not reimposing restrictions. Here's what Dr. Gilpin had to say.
I'm also aware that the governor has made a very strong statement that or a strong recommendation that people take it upon themselves to restrict themselves. And I think that the people who are going to do the right things are already doing the right things. And the people who are not doing the right things will not do the right things. And so I think some of that is preaching to the choir, unfortunately. And in a time like this right now in Southeast Michigan and in Michigan at large, I do think we have to be a little bit more prescriptive.
And so in the absence of that, he is saying again that everybody needs to mask up, wash your hands, stay socially distanced, and above all, get vaccinated. Now, the other thing that the doctor did say is much like what the CDC is saying, it's going to take 6 weeks for the vaccine to take hold for most people. And right now, with the rising numbers, we can't vaccinate our way out of this thing. And so he is saying that everybody needs to really think about their own personal behavior as they move forward in this pandemic. Now, we're going to take a look at all of this, what was said. We're going to be hearing from the Henry Ford Hospital people today, this afternoon, and we're going to be taking a look at what all of this means, and we'll have full coverage coming up on Local 4 News at 4, 5, and 6. Reporting live in West Bloomfield, Rod Maloney, Local 4.
Well, Rod, a question for you. As Beaumont is sounding the alarm here, I know that last year when we were getting to this point, there was makeshift hospitals. There were makeshift hospitals that were in place. Is there any talk about this being a possibility this time?
Well, they claim, and we've already looked to see this tent, but it's not there. At least we couldn't see it. They're saying that there is a triage tent at their Grosse Pointe hospital, but they say that they've always had that action plan in place and that they're looking at that possibility of putting tents outside the hospital in the days to come at Farmington Hills and also Dearborn. They're looking at that possibility, but right now the good news is they're saying that they don't need refrigerated trucks for bodies. So we're at that place where things are really getting tight and difficult. We're not critical like we were this time last year, and the hope is, from their estimation, that we never really get there.
Yeah, and let's hope everybody heeds these warnings and does what they need to do to keep people safe and keep these case numbers down.